let me ask the next question to Dr. Grassi. So when I was crafting the show, I knew I had to have you on because of what you do as an ophthalmologist and a retinal specialist, but a lot of lay people may not understand the importance of having an eye doctor as part of their medical team when you think about diabetes. So can you talk a little bit about maybe that barrier, why maybe sometimes it might be a barrier for people to, or well, I'm taking a step back, why don't you talk about just what's the role of the ophthalmologist and the retinal specialist in diabetes?
Well, it's an interesting point that you raise, and so on one hand, I'll share a statistic with you. So the statistic is diabetes through diabetic retinopathy is the #1 cause in this country of irreversible vision loss, meaning blindness in this country, 2018. So that's a alarming statistic on one hand, and the problem is on the other hand is it's completely asymptomatic until the end stages. And so if you use the analogy of your car, it's like breaking down on the Eisenhower and then the red light going on in the dashboard. That's a little too late, right? And so from a patient standpoint, they say, you know, I'm doing fine. Why would I need to see an eye doctor?
My vision's good, yeah. I get it all the time.
Meanwhile, they can have perfectly fine vision, but the retina can be very diseased and just on the precipice of irreversible vision loss, because the retina, like the brain or spinal cord, is neural tissue. And like most things in life, sort of an ounce of prevention is worth a pound of cure, and so those annual dilated exams that we've talked about before are really critical in terms of being able to prevent that vision loss and be able to sort of going back to that car analogy, look under the hood before the car breaks down.
And I keep a sign in my exam rooms in my office where I've got a picture of two boys. They're holding balls. And the top picture is a kind of a shaded picture. It's kind of foggy, kind of gray. There's a little bit of black spots, not as sharp on the contrast of things. And then I have a bottom picture which you can see the boys in kind of like high-def 20/20 vision, and it says, "Get your eyes checked. Prevent diabetic retinopathy." And I always like to have that sign. That sign really hits home because for a lot of us, we're visual learners. And if you can kind of tell people exactly what you said, if you can say, hey, you may not have any symptoms at all, but I can guarantee you that if your blood sugar is high, there's some stuff going on. So you want to really try to drive home that urgency. Well, let me ask you just a repeat follow-up question. Do you see people at a certain, like when you talk about diabetic changes in the eye, do you see it more at a higher blood sugar level or a lower blood sugar level, or does it really even matter?
So, great question. The two major risk factors for diabetic retinopathy developing and then progressing to vision loss are first, duration of diabetes, meaning the longer you have it, the more risk you're at of developing it. And then almost in a one-to-one level is glycemic level. So your A1C or your blood sugar, the higher that is on average, the more likely you are to develop vision loss from diabetic retinopathy. But the fact of the matter is, all individuals over time will go on to develop diabetic retinopathy. The key thing is that we can prevent these days vision loss in the vast majority of them just through routine care.
And I think about like a lot of routine care, and as a primary care doctor, yes, I'm tasked to do a lot of things, certainly looking for conditions. You know, it's interesting, I want to ask this next question, Dr.